So this is Linda's second microneedling treatment, and the first thing we're going to do is to put a numbing cream on her face so that she's very comfortable during the treatment. There's no pain involved, but there's still a certain amount of vibration that might be uncomfortable.
And this is procedure have a name?
Like collagen, get your collagen back and your elastin production back. So it stimulates it with your needles.
How long will this last?
For each procedure, this is the MicroPen, and I have control over it. I turn it on, you can hear the sound, and each person has a sterilized, what we call needle head, and it comes in this little box, and it's sealed and totally sterile. This does not get opened until we're ready to do the procedure. There are anywhere from 10 to 13 surgical steel needles in here, and the nice part about this procedure is that we have full control. Once the needle head is on, we're going to pass this. You're going to see me passing it on her skin, and you will see me at certain points during the treatment picking the pen up and turning it. I will be changing the needle depth. Different parts of her face will require, I can go a little deeper, and then also depending on how many passes I do and where I do them. For acne scar revision, I do more passes because the whole idea is to smooth out the skin, the surface of the skin. What is beneficial for this treatment? It's anti-aging, and the reason why it's anti-aging is because this microscopic injury that is created on the skin sends the message to the basal layer where the cells are created that we're in trouble, we're injured, we now need to step it up and start producing new skin cells. Therefore, you increase blood flow, oxygenation, which in turn increases collagen production, and you have brand new skin cells coming up. It's kind of like if you ever had a sunburn or you burned yourself on the stove and you have that little red, all of a sudden your skin starts to regenerate itself. So that's what we're doing, but we're doing it in a very, very, very controlled situation because the little injuries that we create on the skin are literally microscopic. In some cases, they're actually smaller than your pore. So it's anti-aging in that sense, and that process is called fibroblast. When your skin goes into fibroblast, it's creating these brand new skin cells. The second people that it's very, very beneficial for is when you're treating acne. Done in combination with other treatments like peels, you can improve the acne situation. You can also, what I've been doing a lot of is post-acne, when someone has active acne going on and it's done, you're over, and now it's 10 years later and you're left with the scars. I'm doing a lot of scar revision. So the skin starts to now get smoothed out, and it's a texturing issue. So those are the three situations that I've really been working on for the last year and a half, and I found tremendous amount of success with. And so we're getting ready to start the microneedling process now, right? I will first be taking the numbing cream off, and then I'll be putting on the gel, and then you'll see me start the process. I normally start in the center of the face first, only because I want to get that over with, because it's a very sensitive area, especially when you go down the nose. You know, your nose is one of those really sensitive areas, and I like to get that over with first. That way, my patient can just relax for the rest of the treatment. Okay, so your forehead, because there's very little fatty tissue between the forehead and the bone, and the nose, the ridge of the nose, again, virtually no fatty tissue. That's why I do that first. Has opted to upgrade her treatment, and there are 3 levels of this treatment. There's just the regular microneedling, and then there's the second step, which is with the growth factor, and you'll see me rolling this on her and adding it. This is just a bump up. It's a more intense, much more intense than the hyaluronic, which is just for moisture. This is to actually feed the skin high doses of growth factor that's taken out of stem cells from bone, because this is a higher level of nourishment for her skin. So I don't like to squirt people because whenever I squirt it on skin, it never works correctly, so I spread it. Now, on the forehead and the nose, I do the least amount.
Had you already done her forehead before? Because I noticed that it's really, really smooth.
And I always put a tissue right here, just in case my client needs to sneeze. So you're gonna see me do 3 passes, and then I will go back to where the areas that I wanna concentrate. All right, I go vertical, horizontal, and then diagonal.
Is it the treatment for crow's feet?
You'll see me, when I get to that point, exactly how I do it.
With that stuff that you put on her face to numb it, she's like not feeling any pain, or does she feel something?
Do you feel pain, Linda?
No. Nothing? She said she doesn't seem to be wincing or anything.
No, there's an intense vibration. I mean, she's feeling that there's a sensation on her skin, but there's no pain.
Yeah, she's perfectly calm. What does that procedure do for, like, if someone has big pores?
It's gonna close them down, and it really helps, yeah.
Well, I just know that you said since it's squeezing the skin, that would probably be a result.
Yeah. Now, I was at a setting of 0.75 on her forehead and her nose, which is a little higher. I normally start people on 0.05. So I've gone to over here, 0.1, and now I'm going up to a 0.75. Ultimately, I'm going to go back on her with a 2. Alright, now we're going to turn it to the other side. And now we're going to do a little peptide. And a little sunblock. I like to use the Epicurean sunblock that we have because it has bee propolis in it. That's very healing on the skin.
May I please have, congratulations, may I please have a glass of any question? What is your date?
Alrighty, and she's done.
That was quick.
Official look of a face peel or plastic surgery. It's pushing back time. What I've really appreciated, I've had some age spots that have diminished since my first treatment. And every day, I feel the skin looks a little bit more youthful, but not artificial. And that's what I'm enjoying.